Good afternoon, everyone. It's 2 o'clock. Time to get started with today's briefing. On the panel, we have Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, Darren Rausch, Health Officer and Director of the Greenfield Health Department, and Erica Sinclair, Founder and CEO of Health Connections and Vice President of the City of Milwaukee Board of Health. Mayor Barrett, you're up first.
Well, thank you very much, Sydney, and good afternoon, everyone. It has been an incredibly busy week here at the City of Milwaukee and at the Health Department, in particular at the Wisconsin Center. We've had a lot of good work done working with the state of Wisconsin, working with the county, and I want to thank the county executive for his cooperation and the many things that we're working on together. And as we move down parallel tracks to fight this pandemic, it's reassuring to me to know that we've got many individuals and organizations that are doing everything they can to get life back to normal. So today, our state-supported mobile vaccination site at All Saints Church near 25th and Capitol Drive opened for select members of the community. I'm proud to say that we've already had a very busy morning at All Saints Church. More than 90 vaccinations were given out. Tomorrow, we're adding St. Ben's, which is just west of downtown, and the schedule there is completely full also. We expect a total of about 500 doses of vaccine will be given out at both locations. And these mobile units are being deployed to address disparities in vaccine distribution, not only in our community, but in our county and throughout the state of Wisconsin. Because of this, these locations are open to those individuals in those areas. When I say those areas, they will be contacted by the representatives from the churches to get the vaccinations. The Milwaukee Health Department will continue to do its work in prioritizing vaccinations for teachers, for childcare providers this week at the Wisconsin Center. And again, it's been a very busy week. To date, we have already provided about 2,700 vaccinations to early childhood and other school teachers. Next week, we'll add vaccination sites at North and South Division High School for Milwaukee Public School teachers and staff. And we'll add also sites for educators and childcare workers at Mitchell and Villard Library. Mitchell Library on the south side, Villard Library on the north side. So you can see what we are trying to do is we are trying to make sure that not only do we have a distribution center in the heart of the city. When I say the heart of the city, I mean in the downtown area at the Wisconsin Center, where the lion's share of vaccines are occurring, but we're branching out into different neighborhoods in the community because we think that is the best way for us to reach individuals in our city. And so people who are interested in vaccination information from the Milwaukee Health Department can visit milwaukee.gov/COVIDvax or call 414-286-6800, or you can just type in City of Milwaukee and our site will come up and that will direct you to the vaccination page as well. A very important point for people over 65, for others who are eligible to receive the vaccine right now. When I say we, I mean the Milwaukee Health Department is not the only game in town. In fact, far from it. Many individuals over the age of 65 have been contacted by their healthcare providers, whether it's Froedtert, whether it's the medical college, whether it's Aurora, whether it's Ascension, or the clinics that we have, the community clinics, which are a big part of this as well. In addition to that, clearly the federal government has made a priority of making sure that many pharmacies in our community have an ample dose of vaccines as well. So again, we have our city sites, but they are not the only game in town. There are the hospital systems, there are the community centers, there are the pharmacies, and this is going to continue to grow. So please, if you have a healthcare provider, contact them or contact your local pharmacy if you are in one of these groups that is eligible to receive it. And I'm talking almost specifically here for those individuals who are over 65, some essential workers who are now in category 1B. I would be checking to see whether if you're a grocery worker or a bus driver, whether you can do it. Again, the city sites are prioritizing this week and next week, the educators and the childcare workers, but you may be able to find something at something else. Patience is a virtue. Again, what we're trying to do is to move as many vaccines as possible into the community as quickly, as safely, and as efficiently as possible. And I will compliment the people at our Wisconsin Center because I continue to receive many, many compliments for the way that operation is being run. So I want to thank all those individuals who are working there also. But that's not the only thing the health department is doing. They are working with other businesses as well to try to get them back to normal, or at least start getting back to normal. And of course, spring is in the air. That means that baseball season is coming. And that means that people are interested in what's going to happen at the stadium. The Brewers have been good partners in finalizing the safety plan for American Family Field. And I know that fans are eager to get back, and the Brewers are very eager to welcome that. I know that for a fact. We are in agreement that the most important issue is safety. So at least at the start of the season, and I stress that, at the start of the season, tailgating will be on hold. So eat that bratwurst at home before you come to the ballpark. Capacity in the stands will be limited to 25% initially. Again, we're hoping that if the numbers go well, if the metrics go well, we'll be able to make changes as the season goes on. The first homestand is essentially 3 games. I think it's the 1st, the 3rd, and the 5th, roughly, of April. I know that the Cubs will be there in the middle of the month, and we've got other teams coming as well. But guests will be asked to remain in their seats, in their ticketed seats, while they're watching the game. Food and beverages will be served, but guests are asked to wait until they are back at their seating location to consume them. Again, a lot of work has gone into this. There was a health department staff walk through last Friday. The Brewers were very, very accommodating. They produced a massive plan that the health department has been able to review, and they're continuing to review it. So this is a partnership, and it's a partnership that's based on public safety, and that's really, really, really important. The final safety plan for the Brewers is an enormous document with lots of detail, more than you'd ever want to know. And I want to compliment again our health department, because the team at the health department deserves a lot of credit for sorting through the Brewers submission and handling the on-site inspections. So we're in a good place. Here we are, it's March 4th. The opening day is set for April 1st. And so the Brewers have the time necessary for them to get the word out to their fans. But if we can make progress in crushing COVID, we can increase the stadium's allowed capacity and get back to tailgating. I'm most interested in winning ball games, though, just to be clear. So if everyone continues to take the safety precautions, masks, distancing, avoiding small group settings, we can reduce COVID infections and get back to Brewers games sooner. Again, opening day is scheduled for April 1st. Spring is in the air. Finally, COVID-19 update. American Family Field is a busy place, not only with the Brewers coming to town, but certainly it continues to be our most active testing location, although not as busy as it was back in November and December. We had 568 people who went through yesterday, Wednesday, March 3rd. It's not closed. It's not open today. It will be open again tomorrow. On the northwest side, we had 104, and on the south side, we had 68. So we've had a total this week of 1,700. Those numbers are down. Dr. Weston can talk about the significance of that if he wants. But my final admonition, if you will, is please continue to seek testing if you are experiencing symptoms or you think you may have been exposed to someone who is tested positive for COVID-19. And with that, I'll turn it over to County Executive Crowley.
Well, thank you so much, Mayor Barrett. We truly appreciate our partnership with all of our partnerships as we continue to fight COVID-19. So today I'd like to start by giving an update on our vaccination efforts, particularly as it relates to our continuous commitment to equity. So with our early focus on racial disparities, structural racism is still producing unequal outcomes for our residents in regards to vaccinations and the effect of the pandemic at large, to be honest. So because of this, Milwaukee County is using zip codes to target the most vulnerable populations to increase equitable access to the COVID-19 vaccine. So starting today, individuals ages 65 and older living in the 53204 and the 53206 zip codes are encouraged to register to be vaccinated at the Kosciuszko Community Center, which is located at 2201 South 7th Street in the city of Milwaukee. During a public health emergency, socially vulnerable populations are especially at risk because of factors like socioeconomic status, household composition, minority status, or housing type and transportation. So using data to identify these populations helps public health officials and emergency response planners meet the needs of their community in emergency response as well as recovery efforts. And our goal really is to remove the barriers to access. These outreach efforts will ultimately help us achieve our vision of being the healthiest county in the state of Wisconsin by striving for racial equity. We are launching this program now to get more vaccine in our most vulnerable communities as quickly as possible. And we hope to expand access to additional zip codes and expand accessibility with transportation options and adding a phone option in the future. So residents who are looking for more information on eligibility, we want you to visit covidmke.com. I'll repeat that again, covidmke.com. Visit that website for more information on eligibility, to fill out a consent form, and to be approved to schedule an appointment. And remember, I want to make sure to say this, the Kosciuszko Community Center is not open for walk-ins. Appointments are going to be required to receive a vaccine. And as more vaccines are administered, we will begin to see some of our favorite places in Milwaukee County begin to reopen. I mean, for example, Mayor Barrett mentioned the Brewers reopening plan being approved. And the Milwaukee Art Museum is scheduled to open Friday, March 5th. And so I know we're all excited to see life slowly return to normal and really to enjoy the things about Milwaukee that make our county unique, because we are known for our art, our music, our sports, food, and much more that has either been put on pause or stripped away entirely during this pandemic. And as we are able to begin enjoying these things again, I want to encourage you to remain vigilant and practice protective measures at all times whenever you can. So just because we're seeing institutions reopen, that does not mean that this pandemic is over. So we must continue to wear masks and practice physical distancing to protect our neighbors, loved ones, and ourselves. We all have a responsibility in ending this pandemic. And so with that, I'd like to hand it over to Dr. Weston.
Thank you, Mr. County Executive. Good afternoon. First to our had 98,167 confirmed cases of COVID-19 in our community and 1,057 individuals who have died in Milwaukee County. Overall, we continue to see low numbers of cases, hospitalizations, and deaths. However, the trend in cases has plateaued. And what we've seen each time this has occurred throughout the pandemic in our community, it's followed by an increase in disease burden. With the new variants in our community, this continues to certainly be a concern. On a positive note, we did see vaccine administration continue to rise with a 20% increase week over week, now with about 4,500 doses being administered per day in Milwaukee County. Though we certainly still saw challenges from an equity standpoint. On that front, today, we're very excited to announce the zip code vaccination program through our Milwaukee County Office of Emergency Management vaccination site. We currently have two main service lines at this site, which is located at the Kosciuszko Community Center on the south side. Our original service line that we opened nearly 9 weeks ago is state-eligible county employees and affiliates. And this includes our EMS and law enforcement partners, as well as now our 911 dispatchers throughout the county. Last week, we added our second service, the phone program, targeting vulnerable Milwaukee County service users that are affiliated with the county, typically lower resource elderly populations. And this week, we're very excited to add the third service line, our zip code program. This program is specific to individuals 65 and older in target zip codes. We will certainly work our way through all of the zip codes in the county, but we are starting with the zip codes with the highest vulnerability, as designed or defined by the Center for Disease Control, the CDC, Social Vulnerability Index, or SVI. The Social Vulnerability Index looks at a number of objective census metrics to categorize communities by vulnerability. By starting this program with individuals 65 and older in the most vulnerable zip codes, we can reach populations that are not only very adversely affected by the pandemic, but also those that are most at risk of hospitalization and death. This is one more step that Milwaukee County is taking to address the equity gap that we have seen and that our public-facing data has demonstrated in the pandemic, and specifically in vaccine administration. So starting now, right this moment, anyone age 65 or older living in the zip codes 53206 or 53204 can go to the website www.covidmke.com and register to receive vaccine at our vaccination site. Our site is staffed by the Milwaukee County Office of Emergency Management Core Team. Core stands for Community Oriented Regional EMS. These are paramedics and EMTs largely from our 14 county fire departments with a passion for community medicine and outreach to underserved populations. So to repeat, if you, your neighbor, your friend is 65 and older and live in 53206 or 53204, you can go to www.covidmke.com and sign up to receive the first dose of your Moderna vaccine. And we'll schedule you on site to receive the second dose as well. So if you have a family member, a neighbor, a friend who meets those criteria, help them to register as well. We will work to broaden to more zip codes, and we'll also work to expand this program, hopefully with transportation as well as other phone options as well. If you jump on the website now, there's even a few appointments available for tomorrow morning, so get vaccinated as soon as you can. We will continue to inform on these briefings as well as other messaging platforms as we expand this to more and more zip codes. We're very happy to be working as a partner side by side with the health departments, the health systems, and other vaccinators throughout the county with the combined goal of getting vaccine into eligible and willing arms as quickly, safely, and equitably as possible. Thank you very much. Stay safe, and I will hand it to Darren Rausch of Greenfield.
Thank you very much, Dr. Weston. Good afternoon, everyone. It's my pleasure to join you today from the Greenfield Health Department to provide a data update from the Epidemiology Intelligence Unit. As we've heard from other speakers here today, the overarching theme in the last couple weeks is that the data has plateaued. And that's very good news. That means our cases have remained stable. Yet it's important to remember that even with low cases, we still have the potential for transmission. And it's very important to keep up the mitigation strategies of watching your distance, wearing a mask, and washing your hands. The trend we're seeing of a plateau is not only seen in the entire population of Milwaukee County, but it's also being seen in our school-age population as well, which is very good news. I'll go ahead and jump into the data now and show you what the data looks like. So this is a figure showing the number of new cases in Milwaukee County since the beginning of the pandemic almost a year ago. And you can see that really since the middle of February, very, very flat trends. And even with some pending data here, it looks like that might be a trend that continues, and we'll watch that carefully in the coming weeks. When we move on to talk about deaths, it's great to see that there haven't been any deaths reported within the last week or so in Milwaukee County. That's important because we're hoping that the vaccination numbers and the vaccination percentage in our senior population, our most vulnerable population in the county, are going up. And we're hoping to see that there's more vaccinations for that population and less severe sequelae from COVID, like hospitalizations and deaths. But again, I'll cautiously remind you that deaths are a lagging indicator, and oftentimes they get reported 2 to 3 weeks after the initial onset of a case. Another thing that we've been watching very carefully for a number of weeks is the transmission rate or the reproductive number. And for many, many weeks, really since about the middle part of January, I've reflected that we've been below 1. And unfortunately, this week, countywide, that transmission rate or that transmission number is above 1. It is 1.09 for the county. And that means for every 1 case diagnosed with COVID, just a little bit more than 1 additional person is going to become a COVID positive case from that initial case. So we want to keep that number low because that helps us suppress disease. When we look at the numbers a little bit more carefully and granularly with the city of Milwaukee at the top and the suburban communities at the bottom, we can see it's a much more pronounced peak in the city of Milwaukee right now than it is in the suburban communities. But in any case, the trend of that transmission rate is heading in the wrong direction, and it's something we want to change. Largely, since cases have been flat, there haven't been any significant changes in our demographic trends. And certainly you heard earlier that testing is available, although testing has been down pretty considerably over the last few weeks. We've been averaging over the last couple of weeks just a little bit over 20,000 tests countywide, and that's probably where we're going to end up this week as well, with some data pending. But we certainly know we have the capacity for more tests. And if testing is something you need, you have symptoms, or you're just interested in knowing, please access testing at one of our testing sites. Lastly, I'll show you a map of our cases, the new cases that have been diagnosed countywide over the last year. And this shows the areas of activity that we've been really experiencing over the last year, and a heavy focus, as Dr. Weston mentioned, on some of the very vulnerable portions of Milwaukee County. Now, when we look more granularly at what's happened in the last 2 weeks, we see a little bit of a different pattern. We see a much more pronounced disease activity in some of the southern suburbs, with some activity in the central city, as well as on the north side of Milwaukee. So again, disease is happening in our community, and you can take steps to prevent disease transmission for yourself and for your family. To end my comments today, I want to wrap up talking about 3 important concepts that we've talked about before and we've addressed in the past. I want to talk first about vaccine availability. Then I want to talk about vaccinating educators. And then lastly, I want to talk about unused vaccine doses. So, as I've said before, we are aware that vaccine allocations will start to increase in the coming weeks. That continues to be a theme that the Wisconsin Department of Health Services is talking to us about. And again, unfortunately, while eligibility does not equal availability, once again, we're moving in the direction that we are actively anticipating more doses very soon in the next week or two. It's likely that the bulk of the doses that will become available to us in the next couple of weeks will be the newly approved Johnson & Johnson vaccine. This vaccine is important because it is only a 1-dose vaccine, whereas the Pfizer and Moderna vaccines require 2 doses spaced several weeks apart. Again, I'll continue to mention, as you've heard before, that the dose available for you is the best vaccine that you can get. So get in where you fit in and take advantage of vaccine opportunities as they become available to you. Vaccine availability in the suburban health departments is expected to increase about 7% over last week. So we are expecting about 3,400 doses in the suburban health departments out of the 8,600 doses that we requested. We also know that vaccine allocations to the city of Milwaukee are increasing. So it's very good news that doses to local health departments in the county are going up. And again, as Mayor Barrett mentioned, local health departments are not the only game in town, and there are many other community vaccinators that are able to help you find vaccine. And Dr. Weston talked about a great opportunity through the county and their core team to get vaccinated as well in certain zip codes to start. So right now, our capacity to vaccinate still remains higher than the doses that are allocated, but that gap is starting to close. Switching to talk about educating or vaccinating educators rather, we're working closely with our healthcare partners to continue to identify ways to get vaccine into the arms of educators and daycare providers throughout the county. Some locations have been fortunate enough to start vaccinations already, while others of us are waiting for allocations to increase so that we can move into that population. So we are committed to vaccinating the eligible educators as soon as possible. And with sufficient vaccine, we're likely to complete the vaccination of educators well in advance of the Department of Health Services goal that they shared last week of vaccinating that population by the end of April. And that would be very good news because it also would allow us to continue to move on with other eligible populations faster. Lastly, I want to talk about the issue related to vaccine wastage. There has been a recent focus on this, both in the news, but it's also been something that we've talked about here in media briefings in the past. Again, I want to remind you that all community vaccinators, public health and other vaccinators are doing our best to eliminate any doses going unused. And in fact, we in public health prefer the term unused vaccines or unused doses because wastage is a word that connotates very negative perceptions. So certainly any unused dose is unfortunate, yet sometimes in the definition of how unused is categorized, for many of the circumstances that lead to unused doses may be out of the control of the community vaccinator. So I have identified 4 different ways that doses may be unused at the end of a clinic. The first of which is a manufacturer error. This includes a broken syringe or a broken vial. This also includes situations where there should be a 6th dose available in the Pfizer vial, but that 6th dose is not attainable given the vaccine syringes that might be available. The second reason that could lead to unused doses is human error. This can be simply a case of a lost vial, a lost syringe, an open vial where it's not all used, or a vial that's drawn and then it wasn't used and the dose became expired. And we'll talk about expired momentarily. Third, an accident. There are situations that are very unfortunate where a vial or a syringe may have dropped to the floor and break, or a syringe may have come apart or malfunctioned during drawing up from the vial or administration. All of these reasons are considered wastage or unused doses. And lastly, expired. While we try very hard to schedule out clinics and schedule the number of people for the vaccines that we have, there are occasionally situations where the number of people that are scheduled don't materialize. Certainly the weather a few weeks ago may have kept some people away from certain clinics on certain days. But expired vaccines certainly is another reason that leads to unused dose, and this is a combination of both human error and/or accident. Statewide, the Department of Health Services will be talking about unused doses a bit more in the coming days. Recently, DHS has shared with local health departments that the percentage of unused doses has been very small during the COVID-19 vaccination effort. In fact, they have pronounced at DHS that of the almost 1.4 million doses that have been given statewide, only about 0.19% have been unused. Of course, any unused dose is unfortunate, but certainly based on the data that's been provided, Wisconsin has been one of the better states at getting shots in arms. And that really is the focus of our collective energy, both in local public health and at other community vaccination sites over the past several weeks. Thank you very much for your time and attention, and I'll now turn the briefing over to Erica Sinclair from Health Connections.
Thank you so much. I'm glad to be here with you today. As mentioned, I'm Erica Sinclair, founder and CEO of Health Connections Incorporated. We are a community-based medical clinic, and we are based on social terms of health and with a focus on population health and public health. The other title I have amongst many is also as the Vice President of the Milwaukee Health Department. And I'm happy to represent also healthcare providers, as I had mentioned earlier. And being in that intersection is very interesting, especially at this time with COVID, because we have been, as a clinic, we have been in the community as one of the community-based testing sites that's supported by Wisconsin DHS, as well as in partnership with North Shore Health Department. Our drive-through testing tent is located at 4425 North Port Washington Road, and is free and open to the public. Anyone can come through. We're there primarily Monday through Friday, 10 to 4, and on Saturdays from 9 to 1. And we're here to support whatever efforts are already going on in Milwaukee County. I'm also happy to report that we, as of yesterday, are officially a vaccinating site as well. So we'll be doing some more community, working with other community partners to create and coordinate community-based vaccine clinics, and that includes working with Milwaukee Health Department and the efforts that they have, and all the other vaccinators within the county. So we are very happy to be able to start doing that kind of work. One reason why I was asked to come on to talk today was about and kind of culminating some things that were already said by the previous speakers. One is to make sure that people understand that vaccines are for COVID are primarily, they do not prevent you from getting COVID, but they are, the purpose of them are to decrease the illness, the severity of your illness if you do get COVID, decrease death and decrease hospitalizations. So within that vein, both Pfizer and Moderna, of course, have been reported as having 95 or 94% protectiveness against COVID, whereas Johnson & Johnson has been noted to have 66% efficacy. And that number has presented some concern in the community around the effectiveness being less in the one dose Johnson & Johnson. And I just want to make sure that people understand that Johnson & Johnson was, when they did the clinical trial, that clinical trial was performed during a time when the South African strain that we now have here within our mix was circulating. So that definitely impacted the effectiveness of the vaccine. However, it also says that it has some protectiveness, and it was actually is actually performed during that time, which allows, but whereas Pfizer and Moderna were not. So that should give you some comfort that there was protection, even with the South African strain circulating during that time of those clinical trials. So, and again, as mentioned earlier, it's also one dose. So for some people, that's better for a lot of different reasons. For scheduling purposes, some people are definitely afraid of needles. Some people just don't interact with the healthcare system, which I hope this experience with COVID helps improve people's their relationships with healthcare. And then it goes both ways. Healthcare, we have to do better about wanting people or enticing or encouraging people to get continue to work and be in relationship with us as far as healthcare is concerned. So I think this is a prime opportunity as we all work together and collectively to get people vaccinated, that we also figure out ways to improve how people access healthcare and how we actually, once they do access healthcare, how we actually give them the healthcare. So I see a lot of opportunity here of improvement all around. Again, I appreciate and I want to thank everyone that's working to get everyone vaccinated. We are very much working as a collective. This is a true utopia as far as a collaboration across government entities, across clinical systems, across community-based organizations. So this summer, and we're working on it now, but again, working with a coordination of vaccinators and community-based organizations to set up community-based vaccine clinics to make sure that people that need the vaccine get it. I know we talk a lot about vaccine hesitancy. I would like to also flip that coin a little bit. Those that are vaccine eager. We have a lot of people who are really ready to get this vaccine. It's very encouraging, and we are so proud to be able to work with our community-based organizations to even have home delivery of the vaccine to people that are just not able to come out. So that's the thing that fuels us as community-based healthcare providers, and that is what we hope everyone walks away with, understanding that all the vaccines that you get in front of you, all of them are good choices. All of them are the right choices. Please take them when your name is called and your number is up, and get it done. If you have to do the 2-dose, make sure you get that second dose. 1 dose is not enough for the full effectiveness, and just follow the instructions, follow the rules. And like someone has said earlier, I look forward to coming outside and playing with everyone, whether that be at baseball or otherwise. And as soon as we can get there is based on if each of us take our individual responsibility seriously, continue to wash your hands, wear your mask, keep your distance, get your vaccine, and take care of yourself, your household, and your community. Thank you.
Thank you so much for joining us. Our first question from the media comes from Patrick Palantonio at WISN 12. It's a Brewers related question. Will MCTS continue the Brewers shuttle on game days, and will the buses have a capacity of 10 people for the Brewers line?
So I have to get back to you on that. We want to continue to have our capacities on our buses because we know this is the safest thing to do. But as it relates to the Brewers games, I will have to get back with you on that information. Great question.
Our next question comes from Allison Durr at the Milwaukee Journal-Sentinel for Mayor Barrett. As the mobile units roll out, how will the city ensure that people who receive the first dose of either of the two current vaccines also get the second dose? And will the mobile clinics return to the same location a few weeks later, for instance?
It's my understanding that they will be signing up for the second dose when they receive the first dose, and the units will return. But if I'm wrong on that, we'll get back to you. But that's my understanding right now. But I will double check that for certain. Second question: How is the city ensuring that the people who come to the closed mobile sites are actually residents of the surrounding area through the outreach that is being done to get the individuals there? This is not a random outreach. A lot of work is being done to make sure that you have individuals who are in high need and live in those areas. So I feel confident about that. Let's see. We have seen fans asking why they can't tailgate, given such a big tailgating. Relax. It's going to happen. It's going to happen at some point. But I think, as Rick Schlesinger said this morning, or he made some reference to this, obviously, if you've got 2 or 3 people, that's one thing, but that can turn into 4. And for those of us who have been at Brewers games, 4 can become 8, 8 can become 16, 16 can become 30, 30 can become 60. And that's exactly what we're trying to avoid. So I think it's a huge win right now that we're going to have fans at the baseball games, and we should savor that today. And as the season goes on, again, it's our hope that these numbers will continue to go down and we'll really be able to get life back to normal.
Our next question comes from Courtney Sisk at WISN 12. How many eligible people live in those 2 zip codes, 53206 and 53204? And what factors go into the social vulnerability index?
Yeah, great question. So 53206, when we're looking at the 65 and older population, 53206 has over 3,000 individuals from the last census data, and 53204 has about 2,700 individuals. So overall, pretty close to 6,000 individuals that would be targeted initially with just these 2 zip codes. The social vulnerability index takes into account 14 different census variables. The CDC website, if you look at social vulnerability, a lot of detail, but it's variables such as income level, access to a car, job status, things of that sort.
Our next question comes from Chuck Kornbach at WUWM for Mayor Barrett. Will city mobile sites be open this weekend, and if so, where?
Again, they're open today at All Saints, tomorrow at St. Ben's. That's the schedule for this week, so the answer is no. These are scheduled sites, scheduled stops where we work with the actual location for them to help us get the individuals there to get the shots. So our schedule is today, All Saints, tomorrow, St. Ben's. We'll make an announcement early next week as to what the sites will be next week. I'm working on the assumption it's going to be at least 2 for next week, and it may be more than that.
I was on mute. Our next question is from Michael Spalding at 620 WTMJ Radio. Were there any discussions with the Brewers and the surrounding bars regarding limits on shuttle capacity to and from baseball games?
The focus, again, was on the games themselves. And I will say that the Brewers were very, very exhaustive in their submission. It's about this big, if I can say that. And I think that that's the following conversations that will occur as how people will get there. But I think it's not going to be as serious an issue when you think of the capacity being between around 11,000 people. Parking is not the issue that it is normally at the games, but all that will be worked out. But again, I'm celebrating the fact that we're going to have fans at baseball games.
We had another couple questions come in through the chat from Allison Durr for County Executive Crowley and Dr. Weston. How many people do you hope to vaccinate through the zip code program? given potential overlap with the county's efforts to reach out to people who are already receiving county services. Do you have a sense for how many doses per week you're hoping to administer through the program? And has transportation been set up to get people to the community center either through the zip code program or the program working with people getting county services?
Well, as of right now, we will be able to administer about 200 doses a week with the zip code program. So, 200 doses a day, which is about 1,000 a week for the zip code program. So that's what we're seeing. And then we talk about the transportation. We are currently looking at how we can look at transportation options, particularly for those who don't have transportation to get to the Kosciuszko Community Center.
Sydney, if I can jump back on an earlier question here, because I've got an answer already. This has to do with the bar shuttle question. We've approved one bar shuttle thus far, and the Brewers indicate that they will only permit those approved by the health department to do shuttle service. So again, it's a work in progress.
Thanks for the update, Mayor Barrett.
And I have one more update as well, which is related to NCTS. And so, yes, we do expect to run Brewers lines for home games, and it will have a 15 passenger limit, just like all of our buses.
Another question came in from Sari Lesk at the Milwaukee Business Journal. Does the Brewers plan account for scaling up capacity like the Bucks plan? For both teams, do you anticipate increasing capacity throughout the season based on how it's going?
Well, again, we're all hoping that it gets better. I can say with 100% certainty that if we increase the capacity, the Brewers will be able to turn that around in about 20 minutes. It's fair to say, and I don't mean this as a negative, they're chomping at the bit to have as many fans as they can in the stands. And we understand that, and we want to be supportive of that. What we're doing is we're looking at the metrics, and as the metrics improve, and I say as they improve because I want to be optimistic, we'll be able to make changes. So I think as the season goes on, it's my hope that in the stands, but I think everybody understands as we're dealing with this pandemic, and as Darren Rausch was saying, we're seeing that spreading number growing again, and that's not what we want to see. So we have to make sure that the metrics are going in the right direction.
Quick follow-up from Sari Lesk. Are there benchmarks to increase capacity?
They are working on those metrics. Again, they are working with them on those metrics.
Another question from Chuck Hornbach at WUWM for Erica Sinclair. Can you say more about your clinic's home delivery vaccine? When would that start and how extensive is it?
Sure. Thank you for the question. We actually are working with other community-based vaccinators that have already received vaccine to carry out that program at this time. We have not received vaccine yet, so we have not been able to, I can't give you a date on that piece, but if there's anyone that's interested and needs that service, please call 414-999-1099, 414-999-1099. Leave us your information. We'll call you back and we'll get you set up with that home delivery.
Another question from Allison Durr at the Journal Sentinel for Mayor Barrett. Do you have any updates on the FEMA site, including whether it's a done deal and whether the federal government will be providing vaccine for the site?
I don't have any updates right now on the FEMA site. We have had extensive conversations with both the state and FEMA. So we're continuing to work to make that a reality.
That appears to be the last question in chat for now. Last call for questions from the media. All right. Thanks everyone for joining us. We will see you back here on Tuesday.
Thank you all.
Thanks, everyone. Thank you.
Thank you.
Thank you.